Thank you, Dr. Dev, for this wonderful insightful talk. I think at this juncture, we can just pause and take questions, both for you and also for Dr. Kaustav Biswas, and then we can move to the third speaker.
Well,
Yes.
Yep, okay. So any question for Dr. Dev or Dr. Biswas? Okay. So, Dr. Dev, I think you suggested that that troponin I and to some extent NT-pro BNP are good markers. I mean, to suggest like which patients could be developing heart failure or other sort of cardiovascular syndromes later. So, do you think that you would also take into account other biomarkers, for example, like CRP or D-dimer? Because that would also be reflective of the basic pathology involved. CRP would indicate that there is inflammation is still going on, and D-dimer may also like reflect on the thrombogenicity of the blood. And we know that these two things actually decide the manifestations of COVID. And also, along with this, which do you think it would be a more sensitive marker? Like if you want to pick up those patients who are going to develop cardiovascular problems, would you go for the biomarkers or would you go for the, say, GLS or cardiac MRI? I mean, biomarkers, I understand, would be cheaper, but I'm from scientific point of view, which one would be more sensitive?
Yeah, very, very important question, pertinent questions. First of all, in the acute stage and during the hospital stay and in the acute stage, all the biomarkers are needed, like the D-dimer, troponin, and also the other biomarkers, what you were suggesting. But during convalescence period, you may not get the CRP and the D-dimer may be raised, that may be reduced. But high sensitivity troponin is very, very important. In fact, in this chart I have shown you, there is a first you do the first ECG and echo, clinical parameters, and the cardiac monitoring. After that, there is only two important things first do. One is the HS troponin and the strain simultaneously. If both or any of them is abnormal, you must go to the MRI with lead gadolinium to see the edema or fibrosis.
Dr. Dev, I like to want some comment from you. Whether in this pandemic, so what should be your message? So should we recommend echocardiography for all patients of COVID, whether symptomatic or asymptomatic? Because we have to give a clear-cut answer. And what should be the timing at the time of admission or at the time of discharge or for convalescence? This is number one. Number two, yes. Besides what you have elaborately described, the strain imaging to detect the subclinical myocardial involvement, we should also remember that RV dilatation with or without RV function are one of the important echocardiographic findings in COVID-19, because basically it is due to lung parenchymal infection and the pulmonary vascular injury. So as the LV is involved, so the RV probably more involved than LV. So we also have to highlight on the status of the RV. And yes, number three is the recommendation of the MRI routinely, especially with a high comorbid and a convalescence period. So these three you just comment so that we can give a take-home message.
Achha. First of all, your first question, what was your first question?
Whether we should recommend echocardiography to all patients and what should be the timing of echocardiography.
Regarding the echocardiography, whenever the patient is hospitalized, we have to do echocardiography on all the patients. That time, during the acute infective state, you may not be able to or even not needed to do the speckle tracking echocardiography. Because see, I'm telling you, if the high sensitivity troponin, D-dimer, and all the biomedical parameters are very high, I have shown the chart. If it is a ST, okay, fine. If it is non-ST, you can do the non-ST elevation, in fact, not like standard treatment. But when you discharge the patient, your second question is very important, because all the patient must do within 15 days of discharge, there are three things. One is the basic first ECG, basic echocardiography, total clinical parameters, and of course, high sensitivity troponin and the echocardiography with GLS. If all are normal, that is when the first patient I told you that patient will be fairly said it can be relatively safe. But if you find either high sensitivity troponin or a GLS is less than 18% and or both of them, then you must do the MRI with lead gadolinium enhancement to find out there is any other edema or the myocarditis or initial fibrosis. Because these are the patients very high risk for developing atrial arrhythmias and the ventricular arrhythmias, atrial fibrillation and the ventricular arrhythmias. Regarding your third question, that is that, what is your third question?
Now, second question was stress on the RV status.
Yeah, RV. That is a very important. Say, during acute stage, there is an RV involvement is there because there is a concomitant involvement of the lungs and ARDS like symptoms, and there is involvement of the RV, and that is what they are. But I am concerning about that if this patient, after recovering from that, this patient may develop lung fibrosis. This patient may develop some pulmonary arterial hypertension. But see, all the literature is initially showing during follow-up, the LV involvement is much more than the RV involvement. That is the paradox. I told you in all these studies, 3-4 studies, whatever has been published in the last 1 or 2 months. But now 1 or 2 studies are coming. The RV GLS is also being, RV free as GLS is also being reduced. And in fact, they are finding if the patients of who develop the LV GLS reduced, you must measure the RV GLS to find out the involvement of the RV. That is it.
Fine.
No, we are
Yeah, one question to you, Dr. A. You showed a case, I think that's probably your third case, in which you showed like the parameters, I think the CRP and D-dimer were normal, and then a few days later, those rose once again. And this patient developed LV dysfunction. What happened to the TROP-I and the NT-proBNP in between? What did
Both are increased. Both are increased. TROP-I and BNP.
No, my question is, did they also normalize only to rise once again, or they had been?
Yeah, they normalize and only to rise once again.
So that's interesting, isn't it? What does it mean?
Yeah, that we do not know. If patient develops some microthromboembolism, or the patient develops some myocarditis. We do not know actually exactly. They either of them or both of them that can develop. But ultimately the patient recovered. And ultimately now the patient is doing well again. Then CRP has been reduced, D-dimer is normal, troponin is reduced. Even now the GLS has been coming to the from 9% to again to 12 to 14%. Why this patient develops second times, I do not know. I don't know a clear-cut answer.
And Dr. De, you have shown in your algorithm that a special group, only a small group, should subject to MRI. Whether it should be expanded to
no, that group is specific. That they showed that either you have and you're not they're telling the randomly going to they're telling either you have a baseline ECG or abnormal echo in the normal echo, or either your HS troponin or the G reduce. Then you go for the MRI. Otherwise, not randomly they are not
concerned about the post-convalescent sudden cardiac death, and we should search out any measures to prevent that.
Yeah.
So picking up early myocarditis with MRI.
I agree with sir. But if this is taking the huge burden of 1 crore population of going the LG with myocarditis, if you advise everybody to post-COVID patient, they will not. So you have to have some strategic plan.
Yes.
particularly we have to find out some high risk patients. Maybe you may lose some few stray cases. I agree with you. But you have to, for a global burden. See, now it is only 1 crore. It may go maybe on to 10 crores, or we do not know, maybe 50 crores.
Yeah, sorry for interrupting. I think we are getting late probably because we have another speaker. So could I request Dr.
Thank you.
Yeah, thank you, Dr. Dey, once again. So Dr. Oyen Kaur, can you actually give your talk? And that is on. Yep.
Thank you, sir.
Yeah, please go ahead.